and can cause flaccid paralysis of the limbs, sometimes permanent, which affects mainly young children. In the most severe cases, the virus can involve the respiratory muscles and make mechanical respiratory support necessary. It is precisely to prevent these forms that, starting from the 1950s, vaccination campaigns were launched. Europe was declared free from endemic transmission of wild poliovirus in 2002, thanks to decades of vaccination that drastically reduced the circulation of the virus. When we speak of wild virus, we refer to the poliovirus in its natural form, not modified by humans, responsible for the major epidemics of the past. There are also vaccine-derived polioviruses, which in very rare cases can develop from the live but attenuated virus used in the oral vaccine. This type of vaccine is no longer used in Europe but remains important where the disease is still present. The case in Hamburg concerns a wild type 1 virus, genetically compatible with strains circulating in areas where polio has not yet been eliminated. This indicates that an infected person, probably asymptomatic, passed through the city and excreted the virus in the faeces, allowing its detection through the environmental surveillance system. Wastewater surveillance is in fact a valuable tool because it makes it possible to detect the presence of viruses even in the absence of clinical cases, giving health authorities the opportunity to intervene promptly. This episode does not mean that poliomyelitis has started spreading again in Europe as it did before vaccination, but it serves as a reminder that as long as the virus continues to circulate somewhere in the world, there is always the possibility that it will be reintroduced into areas considered free of the disease. However, the risk for the general population in countries with high vaccination coverage remains very low. In our country, no cases of poliomyelitis caused by wild virus have been recorded for more than 40 years, and the polio vaccine is included in the vaccination schedule and is mandatory for children. In Italy, the inactivated vaccine is used, which contains a killed virus that cannot replicate but can stimulate an effective immune response and protect against severe forms of the disease. Those who are properly vaccinated therefore have a very high level of protection against the risk of paralysis. It should be remembered, however, that the inactivated vaccine, although safe, does not completely prevent the possibility that a vaccinated person, if exposed to the virus, may host it for a short period in the intestine and excrete it in the faeces. For this reason, if in a community there are pockets of unvaccinated people or people with incomplete vaccination courses, the virus can find fertile ground to spread. The presence of even a small percentage of non-immunized individuals represents a vulnerability that makes it essential to maintain high vaccination coverage. What can we do in practical terms to protect ourselves and our children? The first step is to check that children have received all the doses provided for in the vaccination schedule, and if necessary, to catch up on any missed vaccinations by contacting the pediatrician or the vaccination center. Adults who have to travel to countries where poliomyelitis is still present can also ask their doctor whether a booster dose is advisable. Alongside vaccination, it remains important to take care of hand hygiene, especially after using the toilet and before eating, and to pay attention to the safety of water and food when traveling to parts of the world with weaker health infrastructure. Finally, it is essential to support surveillance and prevention programs, monitoring wastewater, quickly reporting any suspected cases, and ensuring cooperation between health services in different countries are key tools for detecting any possible return of the virus at an early stage. Talking about poliomyelitis today does not mean sounding unjustified alarms, but rather remembering that the achievements of medicine are never guaranteed once and for all, and that they are maintained only if we continue to vaccinate, to keep ourselves properly informed, and to support public health measures.